Greetings from Citizen Health and the Team Academy IAPSME Connect. And in the series of People's Health It Matters, we have Dr. Asma Rahim, who is a professor and head in Department of Community Medicine, Government Medical College, Kerala. Once again, a very warm welcome to you, ma'am.
Thank you, Ritu, and thank you on behalf of to IAPSM Group for giving me this opportunity.
Thank you, ma'am. And we will continue our first session where we were talking about the healthy habits, healthy food street. No, sorry,
Yeah.
where we were talking about healthy food habits for the street vendors, where we have talked about what are the problems that for with the unhygienic habits and what the problems faced by the street food vendors. I'm continuing that session, ma'am, and I'm continuing this session with my next question that what are the requirements for safe food handling the street vendor should be aware of?
Okay, so I could, categorize it into two, like general requirements which the vendor should be aware of, and the specific requirements. So there are three general requirements. One is they should be registered, especially the street food vendors are small scale businesses. So those business enterprises with an annual profit of less than 12 lakhs, they need to have an FSSAI registration. So that registration is important. Second thing is it is better to display that registration in the in their daba. And second thing, another point is that they can. It's good that if they display the notice regarding food safety messages in their daba, and uh, make sure that you get examined by a medical personnel and get a health card issued. So these are the three general requirements. Okay. And coming to specific requirements, they should, before they start a business or when they're running the business, they have to find out a clean area as well as a place to store and transport raw materials, and clean water, potable water, and clean ice also. What we have noticed is this ice, they bring ice from ice plants, but the ice plants do not most of the time skip the attention of the FSSAI authorities, and ice is prepared using contaminated water. So that stringent regulation and frequent monitoring of the quality of the ice which is used to prepare the juice should be done. And this street food vendor would be an innocent victim or a link, in transmitting this disease, because he's not in manufacturing the ice in his unit. So that's important. And so these are the requirements that should be general and specific requirements. But there are certain essential requirements moving on for a daba. They should try to see that food is stored and protected from heat, dust, and sunlight. So if you notice, most of the daba, they're at the roadside, and when the vehicles move on the road, the dust gets deposited in the food and can lead to contamination. And they should have provision to thoroughly wash the utensils for food supply. If it is not possible, try to use disposable utensils. Now, if disposable utensils, they're using it, then they should find out a way for disposing and getting this waste also managed. That's important. And we may notice that these days many we take away. We and the habit of taking foods away from the daba. So in that case, wrapping of food in the clean paper or on suitable material, that should be ensured. And they should find out a mechanism for waste disposal and pest control also in the daba. So these are the few things that requirements of a daba.
Okay, when we talk about rule and regulations, so what do you think that what should the street vendors know regarding food safety regulation and compliance?
Yeah, so the poor street vendors are often unaware that they do come under the regulations of the Food Standards and Safety Authority of India, and there is an act, FSSA Act in 2011. As I said, according to the act, they need to be registered first, and they should also be made aware that they can renew the registration at least 1 to 5 years, because when the authorities come to inspect, this is one thing they're going to ask. And the second thing is whether you have a health card. So the government can, the authorities can help them in various ways, which I'll be talking to you later. So they should know that they come under the purview of this food safety regulation.
Regulation. Okay.
Yes.
And my last question for this session, ma'am, that what are the ways in which local bodies can contribute towards ensuring healthy habits of street food vendors?
Yeah, the government and the local bodies can help them in a lot of ways. Because I've noticed that there are a lot of government initiatives in recent times for ensuring quality of better street food. And the one way is you can provide training to the street vendors, a continued training to the street vendors on safety tips and hygienic ways of handling, preparing, and delivering food. And then the authorities can assist them in getting registered, make them aware how to get registered, which are the portal, how to, because many of them may not know on that. So that is something. And then help them, organize camps for health checkups and get health cards for them. So that the local authority can do. And the government can also introduce schemes for health insurance to the workers and his family also, so that if he's ill, then his financial part is taken care of. And even, I think government has introduced certain schemes in which a grant of 25% towards the cost of setting up a dhaba is being provided. I do not know how much sustainable these programs are, but it is there. And the government can also facilitate microfinance to selected vendors and provide them with a working capital. And the government, I think the FSSAI has started something which is called as a Project Clean Street Food, which is started to assist with safe food business across India. That is a very great initiative from the part of the government, and that needs to be sustained and strengthened to improve the quality of street food, as well as improve the quality of life of the street vendors as well as the general public.
Thank you so much for this beautiful, informative session for our street vendors, for us, for a general public. Thank you so much. And I really hope that we will do another interview on another topic very soon.
Okay. Thank
Thank
you.
you.
Thank you, IPSM, and thank you, Ritu.
Thank you, ma'am. Bye.